tuning in to Beyond the Dais, a podcast about the stories taking place in and around El Paso County, Colorado. I'm your host, Scott Anderson, and today I am joined by Dr. Silpa Krefft, a pulmonologist working with the Department of Veterans Affairs. How are you doing today, Dr. Krefft?
I'm doing great. Thanks for having me, Mr. Anderson.
Yeah, thank you for joining us today. This is actually our first remote interview. All the other interviews I've done so far have been in person, so I really appreciate you, Dr. Krefft, for making the time. You're all the way up there in Aurora, Colorado, I believe. Is that correct?
Yes, that's correct.
Awesome. Well, again, thank you for making the time to be on here today. And I wanted to let our audience know that if you are interested in more stories about people doing good in and around El Paso County, or hearing from county leadership about local government priorities and how they operate, you can find additional episodes of this podcast on your podcast platform of choice. But to get started, Dr. Krefft, I was wondering if you could start by giving some background about yourself prior to your current position.
Sure. So I am an occupational pulmonologist, or really like a pulmonary and critical care specialist that subspecializes in occupational lung disease. So in my training and practice, I've spent a lot of time taking care of people with like work-related asthma and work-related lung disease. Currently, I work at the Rocky Mountain Regional VA Medical Center, where I serve as the site director of a clinical and research program that we call the Post-Deployment Cardiopulmonary Evaluation Network. I also work I also do some research work at National Jewish Health in the Center for Deployment Lung Disease that's led by Dr. Cecile Rose in Denver.
Awesome. Yeah, that's great. So you mentioned the Rocky Mountain VA Medical Center. Can you tell me how that operation works and who that serves?
Sure. So the Rocky Mountain Regional VA Medical Center, sometimes referred to as RMR VAMC, is actually the hub of a larger system called the VA Eastern Colorado Healthcare System. So kind of think about really like Denver area, Colorado Springs, Pueblo. This region of Colorado is all under the same VA leadership. So often veterans who need specialty care, specialty evaluation, or surgical procedures will actually be evaluated at the RMR. Although there are some future plans to expand some of the specialty services in the Colorado Springs area, just because we have such a large number of veterans in that region.
Very cool. So can you tell me some of your primary responsibilities you have specifically with the VA as a pulmonologist with the VA?
Sure. So I spend actually the majority of my time as the main investigator for a research study related to military deployment related lung disease. But I spend about 25% of my time in clinical work, meaning that I spend time both in the outpatient pulmonary clinic, where I evaluate patients with lung disease and sleep problems. I subspecialize in the vast majority of my patients are also coming to see me for concerns about toxic exposures and lung disease, whether or not it's related, or in those cases where we've already established a link, trying to, focus on treatment and following them over time. The other part of my clinical practice is spending some time in the critical care unit, where I also manage patients on the inpatient side. But I would say the most of my practice is spent on clinical and research kind of job tasks related to the PACT Act related conditions, specifically conditions like deployment related asthma, deployment related bronchiolitis, sinus disease. So anything kind of affecting the respiratory tract.
Yeah, and you mentioned the PACT Act. So when it comes to veterans and the veteran population, obviously we have a very large one here in the Colorado Springs area. The PACT Act is certainly something that is out there and it's being talked about. From your perspective, why is that such an important conversation?
Well, I think that it's super helpful in the sense that the PACT Act has I think, taken a lot of the burden of trying to figure out if a lung condition or, a medical condition is related to previous military exposures or not. So some veterans have been, kind of struggling to get the care that they need, or maybe have had asthma after coming back from military deployment and didn't really make the connection that it could be related to their previous military service. I think the PACT Act recognizes that there are some conditions that, previous research has shown, or there's enough concern that these conditions may be related to previous exposures, um, and 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 really kind of provides a little bit of a blueprint of what people can do. Meaning, if you have this diagnosis, or you have unexplained, symptoms like shortness of breath, if you get checked out and you happen to have one of the conditions that's listed in the PACT Act, you could be connected these could be connected to your previous service, and now you're eligible for benefits and treatment for those conditions. So there could be a huge, I think, benefit to veterans who may be seeking some of that care in the private sector, but may be eligible for care in the VA for those conditions.
Yeah, and that makes me want to mention, so August 7th, 8th, and 9th here in Colorado Springs, there's going to be being called a claims clinic, essentially, for the PACT Act, and it'll allow veterans to come in and do a number of things. So we'll be putting out some more information on that in the near future, but definitely something that I think veterans, if you're listening, or spouses or families of veterans, if you're listening, that is something you're going to want to keep in mind. As we move along here, though, I was wondering if you could provide some insights into why respiratory conditions specifically are leading concerns among veterans submitting those PACT Act related claims.
I think the simple answer to that is, while we don't really know the true incidence or prevalence of, how common these conditions are, these respiratory conditions, like I mentioned, the rhinitis, or, runny nose, nasal congestion, sinus problems, asthma, and bronchiolitis, are really the most common complaints that I see in my clinic following military deployment. So I think that's why there seems to be a pretty significant respiratory signal. That's not to say there aren't other health concerns. That's just probably where we're seeing patients, and where some of our research has shown some of that link.
And what are some of those key factors that are contributing to that prevalence of the respiratory diseases among that veteran population?
That's a good question. And when people have asked me kind of a similar question before in the past, like, why is it affecting, my lungs and maybe not other organs? I think kind of a simple part of that is just that our lungs are constantly interacting with the environment. So when there is poor air quality, which we experience here in the US too, but often not to the degree that's been encountered during, deployments to Iraq or Afghanistan, where there's really, and sometimes, very poor air quality. You're constantly breathing in this air, and your sinuses are being affected, the whole respiratory tract. And for some individuals, that results in kind of a longer term injury or inflammation. So I think it's the method of exposure, that we're seeing contribute to what we believe to be a high burden of respiratory disease. Although, future research may show that there may be other health effects that we need to look out for as well.
Mm-hmm. So one thing that I know you have been a part of, so back in May, you actually participated in the first PACT Act Research Symposium for Veterans Health. Would you be able to share some highlights from that and elaborate on why multidisciplinary collaboration is so critical in providing effective care for our veteran population?
Yeah, of course. So the PACT Act Symposium, I think, was an effort to get all of us kind of in the same room. And when I say all of us, I mean researchers, and in part even some clinicians as well, to kind of get an inventory of what all was going on just here locally and regionally in terms of research related to toxic exposures. I think that, from word of mouth and knowing somebody, we'd be put in touch with one or two different investigators. But by having something like the PACT Act to talk about and think about how we could use our collective research skills to answer some of the questions that still need to be answered, and understand what are some of the health concerns related to toxic exposures. This really was an opportunity to get us all out of our silos where, the lung people are just looking at the lung stuff. The mental health group is looking at the mental health issues. And here in Colorado, I would say those are probably the two research powerhouses that we have, like mental health and respiratory research. But we have a number of other research investigators, both cancer specialists and gastroenterologists with that, and just other types of specialists that we'd like to engage. And that PACT Act symposium got us together to discuss how we can try to provide research studies that have a more holistic approach to the veteran rather than individually doing these things. How can we collaborate together to study multiple health effects and potentially interactions between different conditions? So it was not just a one-day event. I think since that time we've actually had some follow-up where we are continuing to work on how to build these collaborations in terms of research, and also, trying to think about ways to be a little bit more veteran centric. I think we've talked a lot about, we mentioned a little bit about the RMR VA being the hub, but I think a longer term goal for us is to have the research studies and the clinical care come to the veterans too. So maybe there's a way to get, to provide some of these services closer to where our veterans live, meaning like Pueblo and Colorado Springs, and not always asking the veteran to come up to us.
Right. Yeah, no, that makes a lot of sense. And you mentioned a lot of what you work on is the research side of that. How could it be beneficial for veterans to be involved in that research, and how does it improve health outcomes for them?
So we have seen that previous participation by veterans, which is often going above and beyond all of the stuff they've already done for us, has really helped get us to where we are in the PACT Act. It is through some of the participation of veterans in research studies that has helped us to understand that people may be at risk for conditions like asthma, bronchitis, bronchiolitis, other kinds of respiratory cancers or other types of cancers. And so, although definitely not required, I mean, for those veterans who have the interest and time and, would want to contribute again, I think that this helps provide answers for some of the things that we don't have answers for yet, and may help us understand the health effects from some of these toxic exposures beyond what we recognize right now with just the PACT Act.
So when you were talking about the symposium, that opportunity to meet with different types of specialists, you brought up the idea of that like siloed research and how by doing that, it makes it a lot more difficult to treat the individual as a whole, right? You're not just treating part of an individual, you're treating all of the individual. So can you talk a little bit more about how that collaboration with those other specialists has really, I don't know if maybe created breakthroughs, but at least help build pathways to create that really more positive outcome for the veterans that you're working with?
Yeah, I think we're still kind of in the early stages of that, but I can tell you that there have been times where both in clinical and research kind of needs, when I've sometimes asked a veteran to, tell me all of the concerns they have or symptoms and rate them in an order. I may be focused on respiratory stuff, but maybe their number one issue is their PTSD. So just in the grand scheme of things, it seems that, to be able to treat that patient effectively, and sometimes there is interactions between these things, that we should be approaching both clinical care and research that way. So we had talked about, this is talking a little bit about a research study we have, but creating kind of a research database or biorepository where we can actually gather information about different kinds of organ systems or different concerns of veterans, and toxic exposures, where this could be a collaboration between different kinds of researchers, so that we are asking some of the mental health questions. We're asking some of the, the stomach, related questions, or the what we call gastrointestinal, and we're asking those respiratory issues all in one place. So avoiding having to ping the same veteran over and over again for different research studies, but not only being more efficient with their time, but also, getting these different specialists to kind of think together and see if maybe patients with asthma who have mental health concerns or who have heartburn or reflux, we're seeing different kinds of outcomes, and it may help us inform treatment or think about research strategies by gathering that information and looking at the whole person.
And so when you're doing that research and you're working with veterans, what are maybe some of the concerns that they bring up to you? And, how do you address those concerns for them to help, whether it's ease their conscience or make them feel better about the research that's being done? What are some of those concerns and some of the responses you have to those?
I think the biggest thing that I have heard from veterans, and this is just kind of my experience and anecdote, is just, being concerned about what is going to happen in the future. So sometimes, they kind of have a sense after they've done testing, both research and clinical, where they're at right now. But 10 years from now, 20 years from now, they want to know, will I be on oxygen? Will I have a higher risk of developing a cancer? And, honestly, those answers I don't know right now. I have now been seeing veterans for deployment-related lung diseases for over a decade. And in my experience, we haven't seen, a lot of significant progressive disease, but I would not say that that's the case for every single individual. And I think we need to not just do kind of a one-time evaluation, but this needs to be in the back of our mind as both medical providers and researchers, so that we are able to answer this question with more confidence in the future. And, and kind of reassure veterans that, with continued work, that hopefully these are kinds of conditions that they will live with and not, and not be all defining. And that's our goal for the future. We definitely see a variety in terms of the severity of disease for veterans, but I think that's the biggest concern I've heard. So I think we need to focus on long-term care and follow up for veterans, and see how what we learn in the future.
Yeah, that's really interesting. And for those who are interested in being a part of that research, or they're currently a part of that research, whatever the case may be, can you talk a little bit about what that kind of expectation is, especially where it relates to like a timetable for research? I know I've actually been a part of some clinical research in my past, and it's one of those things where there's a lot of communication early on. We communicate at like a week, a month, and 2 months, and then it's at a year, and at 5 years, and at 10 years, right? So right. That's just my experience, and I'm sure it's different in a lot of different cases, but maybe just give those who may be interested in it an idea of what they could expect if they were to be a part of that research.
Right. So we actually have a variety. I mean, I'm speaking more on the respiratory side of things now, but I know that even with the mental health group, that there's both long-term studies and kind of shorter-term studies. So there's both options available. And I think it kind of depends on a veteran's expectations, what their schedule is like, and if they'd like to participate in that. For our long-term health outcomes, which is really an area of interest for me, driven mostly by what I've seen clinically. Like I want to, have answers for veterans in the future. We have a longitudinal study where we check in with veterans with questionnaires and lung function testing every. Initially, it had been annually, but during the COVID pandemic, we had moved it to about every 15 to 18 months. But for those veterans with lung problems, we do recommend annual clinical follow-up. So we try to tag team some of the research visits to their clinical visits, so it's not like an extra trip. or taking up a lot of time out of their schedule. For people who are not sure if they're even going to still be in the Colorado Springs area many years from now, we do have an opportunity to participate in something called a research database and biorepository, where they can answer questions related to their deployment exposures, their current health concerns and medical history, and provide a blood sample that can be used for future testing. So there are some options where it's like a one-time participation. And then we, just to kind of give you a sample of the things we have, we also have a clinical trial. It's our first clinical trial in the treatment of deployment-related asthma using kind of a new medication. And this is a multi-site study that's actually a partnership between the VA, the University of Colorado in Aurora, and then also National Jewish Health, where it's a shorter study where veterans can be in a study of trying this new medication for asthma to see if it helps improve symptoms over a 4-month period. So there's kind of a range in terms of participation. Those who can be seen kind of annually to every 15 to 18 months for the research purposes. Some who might have a short but kind of intense research experience, like the clinical trial. And then, another one where it's a one-time participation and are not really necessarily interested in follow-up kind of study visits.
Great. I'm sorry. Continue.
Oh, no, that's it. I was just wondering if that answered your question.
Yeah, absolutely did. Thank you. And I know that there are going to be some research opportunities at this claims clinic I mentioned. Again, it's going to be August 7th, 8th, and 9th here in the Colorado Springs area. But for those who, may not be able to attend or, want to get started right away doing some research, what is the best way for them to get involved in that research?
I think just kind of seeking out like the research table would be the first step. So there will be, we will have representatives from our research group as well as some of the other research groups at our VA will be there. I know that, our VA representative, Mr. Dustin Sanger, had mentioned that there will be some possibility to even provide some specimens for research that will be transported back to the VA. In terms of our studies, there's a little bit more processing that has to take place, and I don't think we have the staff for it at that particular time, but we will definitely have information and research coordinators present to talk about the study, answer questions, and enroll veterans if they're interested.
Very good. And then before we end here, I was just wondering if there's anything else you'd like to add that maybe we haven't discussed yet that you think would be important for listeners to know.
I was just going to say that with the PACT Act coming along, I think that this is a great opportunity for veterans who, maybe have thought about filing a claim or thought about seeking medical care for kind of unexplained shortness of breath or other medical symptoms that they have, to go get checked out. You have a very captive audience right now, both for medical providers and researchers. And I think that I think this is a great time to get some of that information and to know that even, I've sometimes had some veterans who've said, well, I'm not on oxygen, so there's other people who need this more than me. And I think that, there's different ways that these conditions impact our life, and that with all of the service that our veterans have, provided to this country, this is the least I think we can do for them. And hoping that they take advantage of the opportunity to at least get some of their questions answered at some of the upcoming events or just through our VA.
Very good. Well, thank you, Dr. Krefft. I appreciate you taking the time to be with me today and for all the work that you do for our veteran population. So again, thanks for being here. I appreciate it.
Sure. Thanks again.
If you're interested in listening to additional episodes of Beyond the Dais, you can find us on Podbean or wherever you get your podcasts. Thanks for listening, and we'll see you next time.